Hi folks, Rich here, fidgeting on my chair. Not a guitar video as you can see from the title, but something that I wanted to just talk about actually, because I think it might be useful for anybody. So health. Now I've been a sporting person all my life, as a fat kid ironically, but I've always been into sports, and with that comes injuries. Not just broken bones, of which I've had several, but niggly injuries, tendonitis type things, pulled muscles, dodgy back, wonky knees, wonky elbows, things that aren't just a quick fix. And my experience over the years of, if you start, and let's start with my hips. The first time I started having treatment for a dodgy joint was on my hips when I was 15. So you go to the GP and they say, don't do what makes it hurt, have some paracetamol. Not a great answer. You go away for 2 weeks, give it a rest, or you don't, and you hope it'll go away. So then you go back to the docs and they say, well, what they want to say is you're not dying, and what you've done to yourself is all your own fault. Go away and give me some time to look at someone who is dying or is genuinely hurt. Anyway, so then they refer to a physio. You wait, this is in the UK anyway, you wait 6 weeks, 8 weeks, whatever it might be, and then you go and see a physio and they give you some exercises that are seemingly a bit namby-pamby. Maybe they help, some of them do, maybe they don't. Maybe they're more suited to people who are rehabbing from surgery or major accident rather than someone who's into sports and have hurt something. And they say do these exercises 4 times a day, totally impractical, that kind of thing. So you end up just giving it lip service and don't do it, and you go away and you're not repaired. You push on through. My motto has always been push it till it breaks, which I've now done successfully, and you carry on, and then you've got some kind of a long-term thing, or maybe it goes away with the passage of time. So over the years I've just learned not to bother, and this has resulted in I've got a problem with both of my shoulders, but my right shoulder in particular. The rotator cuff area and the shoulder joint is very complicated. There's a lot in there, tendons and ligaments. I was a gym instructor, if you remember, years ago, so I've always been a gym person as well. So there's got some kind of an impingement issue. It gives me issues working in certain planes of movement, but I've just put up with it. So then over time I've developed tendonitis in both of my elbows. My left one in particular is bad, so just picking just the amount of pressure required to hold this phone is giving my elbow grief as we speak. So, but I've just learned to ignore that. What can you do? Doctor can't do anything for you. You might have a jab in it and calm it down for a bit. It's not permanent, and so on and so on. And then the other thing for me, I've always had what appear to be IBS type symptoms. So I've always had tummy issues, always, and I just put up with that, really. And I know that certain foods make things worse, and I abuse it, and sometimes I don't, but more latterly I try and be a bit better about it. And then just over the last how long? About 6, 7, 8 weeks now, I'm sore around my kidney region, and it's been weird. Sometimes it's been hideously painful, like if I always bring you to tears. At other times it's almost not there at all, like now. Very odd. So Sarah prompted me to finally speak to the doctor about it. So anyway, I went to see a doctor. Now I moved to Peterborough 6, 7 months ago, as you know, to be with Sarah, so I had to change the doctor. And I went in and I saw a nurse there, and I don't know what kind of position she is. She's a nurse, not a doctor. Anyway, I was blown away with the difference in service. So I said to her, I went in there, saw her on my kidneys, she had a poke and a prod, and said I did a quick P test and that kind of stuff. And then we got talking, and we talked about my tummy problems and acid reflux and some other things. And she, unbelievable really. So she booked, so we've done some samples, which have been for test, and blood tests. So it's testing for IBS, celiac, bacteria in the gut, some other stuff, kidney function, blood in the urine. So we spoke the other day, and a bunch of things are clear, which is good, but I've still got a problem, so what next? So she's now booked me in for an ultrasound on my abdomen and my kidneys as well, to try and have a suss out what's up with that. She's to a TMI, but it's a colonoscopy, maybe an endoscopy to follow, depending on what comes from that. And whilst I was on the phone the other day, I thought, I might as well go for broke. My right knee is just hideous, just but it just does not want to bend. It's just in constant pain, throbbing. It's been like it for months. It's just getting worse. Just getting in and out of the car, it's horrible. So I thought, oh, what the hell? So I said to her, listen, I've got this dodgy knee. It's been like it for ages. And I gave them a quick backstory on what my experience with the doctors is with these sorts of things. And she said, well, I'm not going to refer you to a physio. We'll send you for an x-ray and have a look. Might be arthritis, it might be something else, but let's start with an x-ray and see what if there's anything to look at. And depending on the results of that, we'll send you off to orthopedics. I'm like, wow, okay. So the point of this video is, I suppose, it's very easy just to suck things up and get on with it, especially when you're used to being in pain in different ways for different reasons, and particularly if you're perhaps someone who's sporty, so you feel like, well, I've induced that's my problem, like my back problem. I had an MRI on that CT scan, sorry, a little while back, and there was nothing skeletal, thank God, but I still have a back problem. But yeah, so sorry, I digress. The point is, don't maybe just suffer it and just leave it. If you're talking to the right person, even in the NHS with a limited resource, if you're talking to the right person, it seems that you can get a better result than that which you think. And worst case, and if you can afford it, then maybe you should pay for something privately. I know my brother, he's also been a sporty guy and screwed up his back, and years ago, getting an MRI on the NHS was like pulling teeth. He just wouldn't do it. So he paid for it privately, cost him an arm and a leg, but just kind of put his health first. So there we go. If you've got anything niggling, I guess the message is maybe don't give up on it after all. Go and be persistent with your doctor. In fact, I did that when I had the MRI on my back. That was exactly what I did, or CT, can't remember which one, I think it's MRI. I said, can you send me for a scan? What is wrong with my back? So look after yourself.